Hi, so Jack Hockley here, and this episode will be on invisible illnesses, which Eve and I have actually. Before I worked as a patient, or not a patient, as a nurse who primarily sees wounds, chronic wounds, I didn't ever think about, I thought about what was going on in people's heads, but not what's going on in people's bodies. So invisible illnesses, they could take quite a few different forms. Um, the wound care patients being one. Every time you see someone walking down the street, they might have a gaping wound somewhere on their body that has a bandage on it. Or if they're using a cane, might be something on that side. I personally went through an experience with one recently, but a lot of good came out of it. Um, I think I changed best practice at least twice, but that's for a whole other thing. So basically, there's a few different things that when you're meeting someone, and especially healthcare providers to patients, we aren't thinking about these things enough when we're interacting with them. Mental health being one of the biggest issues. So, you can't see mental health. It's always obvious once it's been pointed out, but no one wants to be the first one to put it out there. Or think that they just think they're a shitty person or whatever else when really they got some stuff going on. Um, Another thing that you might not ever think about when you're walking around, how many of the people around you have cancer? You ever think about that? How many days the people around them have left? Working as a healthcare provider can really change you and the way you look at things. But it's a good lesson for anyone to know. The same with heart disease, hypertension. You can't see someone's raised blood pressure. There's no possible way other than measuring it. Most people don't find out for sometimes years since they started having it. It just gets randomly brought up somewhere, and then after that, they've got the diagnosis. Ostomies and catheters. So people are walking around with ostomies, which are bags that hold feces. They go into your intestine at various points depending on your illness condition. So it's basically a bag for poop. Um, so many people walking around with those. Catheters, as in they're walking around and it's peeing for them. Yeah, that can be happening as well. Um, those are just a few of the things that I now actually try to keep in mind always when I'm seeing a patient for the first time. What is, I mean, you gotta always ask if they have any other issues than the primary one, because they very well might. And as a nurse, you're probably the most likely person for them to open up to. I believe paramedics are slightly more trusted than nurses right now, with the top spot being right above that firefighter. Those people probably trust. Police and lawyers much lower. So yeah, as nurses, we should be thinking about these things, asking about these things, wondering about these things as we're going about what we do. For all you know, the first time you take that blood pressure, you might be discovering the high blood pressure. That's all you. That's on you. That's yours. Prescribing drugs for blood pressure, that's easy. The hard part's playing detective and finding things. And don't get me wrong, hypertension is not hard to look for. It's one of the easiest things. That's just an example that everyone, I think, can relate to. as you basically just diagnosed it as a nurse. It's just going in as hypertension after 2 more readings. But you can often tell the type of individual who's going to have hypertension. Sometimes not. I've seen some skinny people with hypertension. But usually, they have metabolic syndrome, which covers a few different things, all of which involve being heavy. Anyways, before I start down any other tangents, if you ever have any questions for me, write them in the channel, and I'll answer them in my next feed. Otherwise, I gotta go and figure out what my next few videos will be, probably related to what I do for a living. That'll be the first nursing specialty we explore.